Hey everybody, welcome back to my channel. Today is the video that I promised that I would do about my treatment and what they did for the type of thyroid cancer that I had. Like I said in my last video where I talked about my pathology report, there's 4 different types of thyroid cancer, and each type, it depends on what type of treatment you have. I had papillary thyroid carcinoma, and my nodules were on the smaller side, so they were probably not going to be doing an aggressive type of treatment. So what I had scheduled was 3 days in a row. It started this past Tuesday. Today's Thursday. It started Tuesday on the 27th of February, and I had to go to the hospital, a local hospital. It's about 45 minutes from my house. There's no other hospital in the area that does this type of of treatment, so I had to go a little bit further away than I would like, but it's still pretty convenient considering, you know, some people don't have the option to have this treatment where they live. So the first day I went in for a shot called a thyroid shot, and they gave me the shot in my left arm first. I don't really like needles, so yeah, of course the needle hurt, but the medicine also hurt. It was more of a burning feeling, and I could feel it when she's put it in my arm, and then I could feel it go down my arm, all the way down past my elbow, kind of between my elbow and my wrist, and then I couldn't feel it anymore. So it didn't last a long time, but it was pretty painful. And then, so I went home after that. Then the second day, which was the next day, which was Wednesday, February the 28th, I went back for a second thyroid shot. This shot they gave me in my right arm, and it hurt worse than the first shot. I don't know if she hit a nerve or something, but the burning pain was just deeper and lasted a little bit longer. Went down my arm the same way like the first one did, and then the pain was gone. But the pain from the first shot was really bad on the second day. My arm was really sore. I could lift it. I didn't have any problems lifting it. It was just like touching it. It was really sore. From what they give you in your arm. So then after the second thyroid shot, I had to swallow a very light dose of radioactive. It was a pill, and it looked like just a blue capsule. That's what they call a tracer dose. And so I swallowed that with water. I was not allowed to have anything to eat or drink 4 hours before my appointment. And then once I swallowed that, the tech held up I think it was a Geiger counter, whatever they hold up to you that beeps, and it was in my stomach. And so he just had to do that to check to make sure it was there. And once they did that, then I got to go home. So I wasn't there very long yesterday. Then today was, I guess, what you would call the big day. Again, I had to go in with nothing to eat or drink 4 hours before. Now, this morning I had to be there at 8 o'clock. The first thing they did was a whole body scan, and they put you on this table that's 14 inches wide. I mean, it's not big enough for anybody, but they put you on this table, and then they put the thing under your leg and your knees so that you're pretty comfortable. They put a pillow under your head. And it's really an open type machine. I'm not claustrophobic, but if you are claustrophobic, it might bother you. But you're not closed in. The beginning of the test, I don't know what they call it, the piece that actually takes the photographs was like really close to my face. And then slowly through the test, your body just pulls out. And I was moving so slow, I didn't realize I was moving until I looked up at the ceiling and I could see the tiles on the ceiling were moving slowly. So I knew I was moving, but it just takes a while. The test took 21 minutes. Then he moved me over to a close-up shot that they just do of this area right here. And that's just of the thyroid area. You know, when you get in those machines, before you get in them, they ask you if you're okay. You got to go to the bathroom. No, I'm fine. I'm doing fine. And then as soon as he tells you don't move, you have to scratch. You have to sneeze. You have to pee. You have to poop. Everything. And I mean, it doesn't hurt. It's just knowing that you can't move. And they strapped me in, and I was like, I'm going to fall off this table because it's like 14 inches wide. It's not big enough for anybody. So once I had that done, then I was going to meet with the radiologist. Because the radiologist was going to review my results, and then depending on what the test showed, would determine on the dose of radioactive iodine that I would receive before I left the hospital. So the radiologist comes in, and he was really nice, and he wanted to talk to my endocrinologist before he made any decisions, make sure they were on the same page, and so he talked to her first. And because my particular experience, my nodules were on the smaller side, my age, those are the things that determine what stage you're in, and that also is a factor in how much radioactive iodine they give you. And so I received 30 MCI, and I don't know what that stands for. It's like microcurials or mercurial, something like that. And so it takes a while for the pill to get there because it comes from a different place. It's not even in the same hospital, so it has to come. It takes like an hour to get there. So they have to order it because they are not pre-made. I mean, it's a radioactive pill. They can't just go to the cabinet and pull one out. So while I'm waiting for the pill to get there, I have to go upstairs for blood work. They want a baseline of my thyroid levels and all that good stuff. So I go upstairs to have blood work, come back down. I didn't have to wait too long. And then the tech comes and gets me, and he's asks if I'm ready, and I'm like, sure, I'm just ready to get this over with. I just want to go home. I wasn't really feeling sick. I was just anxious to get it over with. So he takes me into this room, and I walk in, and I see the box on the floor that the pill came in. It was an ammo box, and inside the ammo box, the pill comes in a container that's, it's pretty, it's not small, but it's not, I guess it is small. It's about, 5 inches by 4 inches, but it weighs 20 pounds. And the pill comes in that. So then they take it out of that lead casing and put it in their machine, and they're just testing it to make sure that the lab that made it sent over what they requested. And then the thing that they put it in the hospital is actually surrounded by these lead blocks. And so he pulls it out, and it's in this plastic thing, and they won't let me touch it. I have to drink water, swallow it. This pill was a different color than the one I took yesterday. The one I took yesterday was blue. This one was white. Same size, same shape, though, just different color. So I swallowed it, didn't have any problems. He held the Geiger counter up to me, make sure that it was working, and it was. But as soon as I walked out of the door, I had this nasty kind of like metallic taste in my mouth. It didn't last long, maybe about 3 minutes. And then they pretty much kick you out. I had to sit in the back seat, diagonal from my husband. I had to sit on a sheet, and it took us about an hour to get home, and they like for you to be home by 2 hours, and about 2 hours after I swallowed the pill, I got sick. I did not throw up, but I had horrible stomach cramps, and it just kind of started at the top of my stomach and then just went all the way down, and it was very unpleasant. And throughout the evening, so it's it's almost 10 o'clock, and so I had the pill at like 10 o'clock this morning, so it's been about 12 hours. And since the first pain episode, I've had minor pains in my stomach, but it's just uncomfortable. I have had a little bit of pain in my neck. It's nothing bad. He did say that could happen. It's just the tissue that's left in there responding to the treatment. There's a chance my salivary glands could swell up and be sore. So tomorrow I start the sour candy to suck on those for every hour, I believe. And next Wednesday, I go back for my second and final body scan. And that tells them if the treatment worked. So today, the doctor told me that the cancer had not spread. And that's really exciting. I expected that it hadn't, but to hear it was wonderful. So next week, I'll find out if the treatment worked. And then hopefully just regular scans and checkups with my doctor, and it'll be gone. So everybody's experience is going to be a little bit different depending on what type of thyroid cancer you could possibly have. And then it's going to be based on your stage, that sort of thing. So my experience might not be the same as yours. There are some doctors who don't do the thyrogen shots, and if they don't do them, then they like for you to be off your medicine for 4 to 6 weeks, but then that can cause other health problems, make you sick, that sort of thing. So the thyrogen shots allow you to stay on your thyroid medication, and I'm so glad that my doctor does that, because I wasn't feeling good, and I think that really helped me not to feel worse. So that is my thyroid cancer treatment experience, and if you have questions, please do not hesitate to ask. Again, if you have a thyroid cancer, please check with your doctor with what type of treatment that you're going to have, and don't rely on my experience to be just like yours, because everybody's experience is different. But this is going to help you understand a little bit about how some of the treatment does work. So don't forget to subscribe, and I'll see you next time. Thanks.